Maybe if we start off, if I ask you to just tell us a little bit about your background and your position at the moment.
I've been a GP for 25 years or more. I work in central London. And the whole issue of sustainability was really not on my radar until I took a sabbatical. And I went away for 6 months and I travelled. And I went up to the Arctic and I saw what was going on, and I went to the slums of Nairobi. And I came back and I realised that the whole issue of the environment and indeed health and the environment was really important. And it's going to be the biggest issue for the next generation, and but the time to do something about it is now.
What are the main things that you've been working on since then?
Okay, so I helped the clinical commissioning group, and they're the groups that are coming in April that will have 80% of the budget. And I'm advising our local one on what they should be doing in terms of sustainability. And we've looked at a number of areas. We've looked at the contracts that we'll be having with the hospital. We've looked at what we're doing and whether we could do it more efficiently. And in particular, we've looked at prescribing. Prescribing accounts for 30% of the total NHS carbon footprint. And then finally, we looked at the practices themselves. And in fact, we had a medical student over the summer and who worked with the practices to look at how they are using electricity and heating and so on and so forth. And we've also got ideas around patient travel and staff travel, so that you begin to get an idea of the consumption.
And things maybe about sort of self-care and empowering patients as well, to
absolutely
kind of take charge on their own.
Yeah, there are 3 elements you need, really. One is the relationship. Secondly, you need to give people skills and education and do it in groups with peers who've got the same problem. And if you do those 2 things, then people change their attitudes about how they can manage themselves, and it becomes long term.
Yeah. I suppose the other thing I kind of wanted to ask was, because we're a student organisation and a lot of the people that we kind of work with and try to engage are students, particularly medical students. If you were maybe starting off as a medical student now, and this all seems quite big and complex, there's lots of stuff going on around NHS sustainability, but it's quite difficult to know
how to get involved,
where to start, and sort of what you could do.
Okay, well, I would have thought that's a good point. I mean, you could. One thing you could do, you could look at different models of care. So you could say, look at diabetes and how should diabetic care be delivered in an area. And you could look at the models in America where they have an HMO organisation, you have a sort of diabetic czar who gets the budget, and every admission comes out of his budget, so he's incentivised to keep people out of hospital. And look at different models of care. You could do a project on that or some other area.
Maybe with the CSA, the Centre for Sustainable Healthcare.
You could do. You could have an attachment to them. You could spend time with the clinical commissioning groups and see, since they are going to be driving new patterns of care, what their thinking is, and have some, you could learn from them. You could do a project such as this medical student did this summer, going into practices or into an organisation, a hospital, be attached to whoever's relevant there, and look at the environmental impact that an organisation has. Yeah. I mean, those would be 3 ideas you could get involved in.
Yeah. Well, it's something that we kind of are hoping to do more on, and to get more students involved in. Obviously, NHS Sustainability Day would be kind of
a good one.
Focus for that, and hopefully manage to get the message about NHS sustainability out there.